Heart failure is far more than a technical medical phrase. It has become a growing public health emergency. Today, over 6.2 million adults in the United States are living with this condition, and that number climbs higher every single year. Once seen mainly as a disease of older adults, heart failure is now appearing more frequently in younger people and is hitting minority communities especially hard. The Heart Failure Society of America's 2024 report shows an even more troubling trend. Death rates in these vulnerable groups are rising. The facts are stark. According to the CDC, roughly half of all people diagnosed with heart failure will die within 5 years. Yet there is a powerful, hopeful side to this story. When heart failure is recognized, early treatment can change the course of the disease. Your body almost never begins with a dramatic alarm. It rarely screams. Instead, it sends quiet warnings. Many people brush these off as simple tiredness, stress, or just another sign of getting older. In reality, they may be subtle clues that the heart is struggling long before a crisis hits. This video is not meant to scare you. Its purpose is to give you knowledge and control. Together, we will walk through 12 early signs of heart failure that are easy to overlook yet crucial to notice. They may not resemble the classic image of sudden crushing chest pain, but they matter just as much. By understanding these early signals, now you give yourself a real chance to protect your heart. Speak up sooner and seek help before the situation becomes life-threatening. Disclaimer: this video is intended for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always speak with a licensed healthcare professional about any questions or concerns related to your health, medical conditions, or treatment options. All information shared here has been carefully researched and cross-checked with reliable sources. You can find the reference links in the video description. 1. Shortness of breath with activity, known as dyspnea on exertion. Among the earliest and most frequent warning signs of heart failure is feeling unusually short of breath during physical tasks that used to feel easy. Doctors refer to this as dyspnea on exertion, and it develops when the left ventricle becomes too weak to pump blood efficiently. As pressure builds up in the pulmonary circulation, fluid begins to seep into the lung tissue. At first, you may only notice this when climbing a single flight of stairs, walking uphill, or moving quickly over a few city blocks. According to the New York Heart Association, this pattern typically corresponds to Class 2 heart failure. The troubling part is that the symptom tends to worsen over time as everyday activities slowly become more challenging. This breathlessness occurs because your heart can no longer keep up with the increased oxygen demands of your muscles during exertion. A weakened heart muscle cannot adequately boost its pumping capacity when you move, so your body compensates by making your lungs and breathing muscles work harder. That extra strain on the respiratory system creates the uncomfortable sensation of air hunger. Studies indicate that dyspnea on exertion is present in about 85% of people with heart failure at the time they are first diagnosed. Unfortunately, many individuals shrug it off as poor fitness, lack of exercise, or just a normal part of getting older, and this misunderstanding can postpone vital medical care for months or even years. It is essential to notice even subtle changes in how much activity you can tolerate. If you realize that you now have to pause to catch your breath during routine tasks you once completed without a second thought, it is a clear signal that you should see a healthcare professional promptly. Recognizing exertional dyspnea early opens the door to treatments that can greatly improve your daily comfort, preserve your independence, and enhance your long-term outlook. 2. Orthopnea. Orthopnea is the term doctors use for shortness of breath that appears or worsens, specifically when you are lying flat, and eases when you sit up or raise your upper body with pillows. This warning sign usually appears in more advanced heart failure, often matching New York Heart Association Class 3 or Class 4 disease. The underlying physiology is closely tied to gravity and how your blood shifts when you change position. When you lie flat, venous blood from your legs and abdomen returns more quickly to your already weakened heart. Because the left ventricle cannot pump effectively, this sudden increase in venous return overwhelms its limited capacity, leading to rapid congestion in the lungs. People with orthopnea frequently report that they can only sleep when their head and chest are elevated on several pillows or in a recliner, because breathing becomes much easier in that position. Many patients slowly adapt over time, adding one pillow after another without realizing that this change actually marks a progression of their heart failure. In fact, the number of pillows needed just to sleep comfortably often reflects how severe the condition has become. Clinical data suggest that orthopnea occurs in roughly 65% of individuals with moderate to advanced heart failure. In contrast to dyspnea, with exertion, orthopnea typically signals a later stage in the disease process. It appears because your weakened heart cannot manage the extra volume of blood that returns to it when you lie flat. If you have noticed that you can only rest comfortably when you are propped up, or if you wake suddenly feeling as if you are smothering whenever you try to lie flat, do not consider this a harmless preference. This is a strong indication that your heart is under serious strain and that you need urgent medical assessment. It is not simply about finding a more comfortable sleeping position. It is a significant red flag that deserves prompt evaluation. 3. Peripheral edema. Swelling of the legs and ankles. When your feet, ankles, and lower legs begin to swell and stay that way, doctors call it peripheral edema. This is one of the classic outward signs of heart failure, especially when the right side of the heart is affected or when the disease has progressed to involve both ventricles. This is not the mild puffiness you might notice after standing all day. Instead, it is a persistent buildup of fluid that gradually worsens over time. According to the American Heart Association, peripheral edema develops when a weakened heart can no longer pump blood forward efficiently. Pressure rises in the venous system, and that elevated pressure pushes fluid out of the blood vessels and into the surrounding tissues. Because of gravity, this extra fluid tends to settle in the lowest parts of the body, most commonly the feet and ankles. Swelling caused by heart failure has features that help distinguish it from other kinds of edema. It usually begins around the feet and ankles, often affects both legs in a similar way, and leaves a noticeable dent when you press your finger into the area, a finding known as pitting edema. Many people notice that the swelling becomes more pronounced as the day goes on and may improve somewhat overnight if the legs are elevated. Research indicates that peripheral edema is seen in about 75% of individuals with heart failure, typically appearing after shortness of breath with exertion has already started. This type of swelling often corresponds to New York Heart Association Class 2 or Class 3 heart failure and reflects a moderate degree of cardiac impairment. In many cases, the more severe the edema, the more significant the underlying heart dysfunction. It is wise to keep a close eye on your lower legs and ankles, particularly if you are also experiencing symptoms such as breathlessness or unusual tiredness. If you press a fingertip into the skin around your ankle and the indentation remains for several seconds, it strongly suggests fluid retention. A rising body weight that occurs along with this swelling is an additional sign of fluid buildup and should prompt immediate medical evaluation. 4. Ongoing cough or wheezing that will not go away. A lingering dry cough that continues despite using cough syrups or over-the-counter cold remedies can be an early warning sign of heart failure. This so-called cardiac cough develops when fluid begins to build up in the lungs, irritating receptors in the bronchial passages and triggering the cough reflex. Unlike a cough from a typical respiratory infection, it does not improve with standard treatments. The American Heart Association points out that in some cases this cough may bring up pink, frothy sputum, a sign of severe fluid overload in the lungs. The pink color comes from small amounts of blood mixing with the lung fluid, while the foamy, bubbly appearance is caused by air combining with that excess fluid. When this type of sputum appears, it is considered a medical emergency. Wheezing can also be part of heart failure, especially when fluid accumulation becomes more pronounced. This cardiac type of wheeze is different from asthma because it usually does not respond to bronchodilator medications such as albuterol. The sound occurs because excess fluid narrows the airways and creates turbulent airflow as you breathe. Research suggests that around 70% of people with heart failure experience respiratory symptoms, with cough often appearing early in the course of the disease. Many patients notice that the cough is worse when they lie flat and eases when they sit up, which can resemble orthopnea. Because of this, it is frequently misattributed to allergies, acid reflux, or side effects from medications. However, a persistent cough, especially when it appears along with tiredness or shortness of breath, should always raise suspicion for a heart problem and lead to a thorough cardiac evaluation. 5. Fatigue and weakness. Crushing tiredness and a sense of weakness are often among the very first signs of heart failure, yet they are easily missed because they creep in slowly. This is not the ordinary sleepiness you feel after a busy day. It is a deep, draining exhaustion that disrupts daily life and does not fade even after a full night's rest. The underlying cause of this cardiac fatigue is a reduced cardiac output. In simple terms, your heart is no longer able to pump enough oxygen-rich blood to satisfy the needs of your body. As a result, your muscles, brain, and other organs receive less oxygen and fewer nutrients than they require, leading to persistent weakness and a feeling of being completely worn out. Studies show that fatigue is present in roughly 90% of individuals with heart failure and often appears months or even years before more obvious symptoms become noticeable. In the New York Heart Association system, this type of fatigue most often corresponds to Class 2 heart failure, placing it among the earliest detectable warning signs. Because it appears so early, recognizing this pattern of fatigue can be critical in slowing the progression of the disease. The tiredness associated with heart failure has some distinct features. It tends to build as the day goes on, does not improve much with rest, and significantly interferes with ordinary tasks. Many patients describe the feeling as if their tank is always near empty, with no energy reserves left to use. Unfortunately, this kind of fatigue is commonly blamed on getting older, being under stress, or not sleeping well, which delays proper medical attention. If you notice a marked drop in your usual energy levels that lasts for weeks and makes it difficult to carry out normal activities, it should not be ignored. This pattern calls for a thorough cardiac evaluation. Identifying cardiac fatigue early opens the door to treatments that can greatly boost your energy and improve your long-term outlook. 6. Paroxysmal nocturnal dyspnea (PND). Paroxysmal nocturnal dyspnea is one of the most alarming experiences associated with heart failure. It refers to sudden, intense episodes of shortness of breath that wake you from sleep, most often 1 to 3 hours after you have drifted off. People describe these attacks as terrifying as they bolt upright in bed, gasping for air and desperately trying to catch their breath. The Cleveland Clinic recognizes PND as a classic manifestation of congestive heart failure and a late-stage sign of significant left-sided heart dysfunction. The timing of these nighttime events provides important clues about what is happening inside the body. Throughout the day, fluid tends to accumulate in the legs and abdomen. When you lie down to sleep, that fluid shifts back into the circulation and moves toward the lungs. While you sleep, normal circadian changes in hormone levels further influence how your body handles fluid. At the same time, the horizontal position removes the gravitational pull that keeps fluid in the lower extremities, allowing it to redistribute more evenly. When an already weakened left ventricle suddenly has to cope with this extra volume, it quickly becomes overwhelmed, leading to acute congestion in the lungs. Studies show that episodes of paroxysmal nocturnal dyspnea usually last about 10 to 30 minutes and ease once the person sits up or stands. The improvement occurs because gravity again assists in pulling some of the excess fluid away from the lungs and back into the general circulation. However, this temporary relief does not correct the underlying heart failure that triggered the episode in the first place. Sudden nighttime breathlessness consistent with PND is considered a medical emergency. Unlike sleep apnea or disturbing dreams, it is a strong indicator of advanced heart failure. If you find yourself waking abruptly, struggling for air, and noticing that your breathing improves only when you sit upright, you should seek urgent cardiac evaluation. 7. Jugular venous distension, JVD. Jugular venous distension is the term used when the veins in your neck appear visibly enlarged or bulging while you are positioned at about a 45-degree angle. This finding reflects abnormally high pressure in the venous system. Although it takes a trained clinician to evaluate JVD correctly, knowing what it represents can help you understand how serious heart failure can become. The jugular veins are directly connected to the right atrium, so they serve as an external window into how well the right side of your heart is working. When the right ventricle weakens or becomes overloaded, blood begins to back up into the venous circulation, causing veins in the neck that are normally flat or barely visible to become distended. This signals significant cardiac dysfunction and fluid overload. Medical references from the National Center for Biotechnology Information describe JVD as a classic and highly specific sign of heart failure, meaning that when it is present, heart failure is very likely. To assess for jugular venous distension, healthcare providers observe the neck veins while you are reclined at different angles, watching for abnormal fullness that suggests elevated central venous pressure. They often perform a hepatojugular reflux test at the same time. In this maneuver, gentle pressure is applied over the liver. In patients with heart failure, this pressure pushes extra blood into the circulation, and because the failing heart cannot handle the additional volume, the jugular veins become even more distended almost immediately. You cannot reliably evaluate your own jugular veins at home, but understanding JVD helps you appreciate why a detailed physical examination is so important in heart failure. The presence of jugular venous distension usually indicates moderate to severe disease rather than an early or mild stage. If your healthcare professional tells you that they have found a JVD during your exam, it is a strong sign that your heart is under considerable strain and that more intensive monitoring and treatment are needed. 8. Pulmonary crackles, rales. Pulmonary crackles, often referred to as rales, are fine crackling or bubbling sounds that a clinician hears through a stethoscope when you breathe in, usually over the lower parts of your lungs. These abnormal sounds are a strong clue that fluid has begun to collect inside the tiny air sacs of the lungs called alveoli, a condition known as pulmonary edema that commonly results from left-sided heart failure. The characteristic crackling noise is produced when air is drawn in and forced through fluid-filled alveoli, causing them to snap open during inhalation. Because of gravity, fluid tends to settle in the lowest lung regions first, so these sounds are typically detected at the bases before anywhere else. The presence of pulmonary crackles usually indicates a more advanced stage of heart failure, appearing when fluid accumulation has become significant and the disease is moderate to severe. Unlike other abnormal breath sounds such as wheezes, which suggest narrowed or obstructed airways, crackles point specifically to fluid within the lung tissue itself rather than airway inflammation alone. The extent of crackles often mirrors how congested the lungs have become. In early stages, they may only be heard at the bases and only with deep breaths, but as heart failure progresses, they spread higher up the lungs and can eventually be heard even with normal, quiet breathing. While you cannot listen to your own lungs, your doctor will carefully check for crackles during an examination. When these sounds are present along with shortness of breath or other cardiac symptoms, they strongly suggest significant heart dysfunction and the need for prompt medical attention. 9. Third heart sound, S3 gallop. The third heart sound, called an S3 gallop, is an additional heart sound that follows immediately after the normal lub-dub, creating a cadence that resembles the rhythm of a galloping horse. This extra sound is one of the most sensitive early warning signs of heart failure and can sometimes be detected before any obvious symptoms appear. Research from the National Center for Biotechnology Information shows that an S3 gallop reflects increased filling pressures and volume overload in the ventricles. It arises during rapid ventricular filling when blood flows forcefully into a ventricle that is already overfilled or abnormally stiff. That sudden rush of blood produces vibrations in the heart, muscle, and surrounding structures, which generate the characteristic low-pitched sound. The presence of an S3 gallop carries special diagnostic importance because it can emerge early in the course of heart failure, sometimes even before leg swelling or marked shortness of breath is noticeable. Clinicians regard it as one of the most trustworthy physical exam findings for identifying heart failure and for recognizing patients who are likely to benefit from heart failure therapies. The S3 sound occurs in early diastole during the phase when the ventricles are rapidly filling with blood, and it suggests that the heart is too weak or too stiff to accommodate that volume in a normal way. Although you cannot hear this sound on your own, the detection of an S3 gallop during a medical examination is a clear sign of early heart dysfunction, even if you have not yet experienced significant symptoms. 10. Rapid weight gain. A sudden jump on the scale over just a few days is one of the most dependable early clues that heart failure is getting worse. This is not the slow, gradual weight gain that comes from eating more or moving less. It is a quick increase caused by fluid building up in your body, often adding 3 to 5 pounds or more within a very short time. The National Center for Biotechnology Information highlights that careful day-to-day weight tracking is a key part of heart failure care because changes on the scale reflect fluid retention more accurately than how you feel. Roughly speaking, each additional pound represents about 500 milliliters of extra fluid, making your weight an objective snapshot of your fluid status. For this reason, healthcare professionals usually advise people with heart failure to weigh themselves at the same time every day. Ideally first thing in the morning after using the bathroom and before eating or drinking anything. A gain of 2 to 3 pounds in a single day or 5 pounds within a week is a red flag that should trigger an immediate call to your medical team as it signals significant fluid buildup. This rapid weight gain occurs because a weakened heart pumps less effectively, which leads the kidneys to hold on to sodium and water, expanding the total fluid volume in your body. While this mechanism may briefly help maintain blood flow over time, it places even more strain on the already failing heart. Knowing your usual weight, tracking it daily, and promptly reporting sudden increases, especially when accompanied by swelling or shortness of breath, can allow your provider to adjust treatment early and help prevent serious complications and hospital admission. 11. Hepatomegaly liver congestion. Hepatomegaly is the medical term for an enlarged liver, and in chronic right-sided heart failure, it occurs when blood backs up into the liver, causing it to become swollen, tender, and unusually firm when examined. This finding reflects an advanced stage of heart failure and shows that your cardiovascular system can no longer keep blood flowing in its normal pattern. The liver essentially becomes overfilled with blood, much like a sponge that has absorbed too much water. This congestion disrupts normal liver function and often leads to a deep sense of discomfort. Many people feel pain or pressure in the right upper part of the abdomen, especially when taking a deep breath or bending forward. This type of pain is different from ordinary stomach discomfort because it comes from stretching of the liver capsule due to internal congestion, not from indigestion gas or strained muscles. Hepatomegaly is frequently accompanied by symptoms such as poor appetite, nausea, and early satiety, the sensation of feeling full after only a small amount of food. These problems arise both because the enlarged liver physically presses on nearby abdominal organs and because congested liver tissue cannot support digestion normally. Some individuals also notice that their abdomen looks more distended or that their waistband feels tighter even if their overall weight has not changed much. Liver enlargement from congestion usually appears in advanced heart failure and often occurs alongside other serious signs, such as marked peripheral edema and ascites. If you develop unexplained pain or discomfort on the right side of your abdomen, particularly in combination with other symptoms of heart failure, it is critical to seek prompt medical evaluation. The presence of liver congestion signals that your heart failure has progressed substantially and that you may need aggressive medical treatment and close monitoring. 12. Ascites abdominal fluid buildup. Ascites is the medical term for fluid collecting inside the peritoneal cavity, the space between the inner surface of your abdominal wall and your organs. When this happens in the setting of heart failure, it usually signals late-stage right-sided or biventricular heart failure. The condition develops when severe venous congestion causes fluid to seep out of overloaded blood vessels and into the abdominal cavity. In advanced heart failure, the markedly increased venous pressure forces fluid through the vessel walls into body spaces, and the abdomen is one of the most common places where this excess fluid settles. People with ascites often notice that their abdomen slowly becomes more swollen and rounded, and this bloating does not improve with diet changes, reduced salt, or over-the-counter gas-relieving medications. The accumulating fluid makes the belly look distended and feel heavy, tight, or uncomfortable. Unlike ordinary digestive bloating, which tends to fluctuate, ascites cause a persistent abdominal enlargement that progressively worsens over time. In the context of heart failure, ascites is a clear sign of severe fluid overload and advanced cardiac dysfunction. It often appears alongside other symptoms, such as marked leg swelling, an enlarged, congested liver, and worsening shortness of breath. Many patients begin to notice that their clothes or belts feel tight around the waist, they feel an uncomfortable sense of fullness, or they have difficulty bending forward because of the increased abdominal girth. Any ongoing or worsening abdominal swelling in this setting requires urgent medical evaluation to avoid serious complications. You should not wait for the discomfort to become unbearable or for breathing to become severely difficult. If you observe these warning signs, contact your healthcare provider immediately. Timely intervention can reduce fluid overload, help prevent hospitalizations, and allow you to live more comfortably and safely with heart failure. Heart failure rarely arrives all at once. It sneaks in quietly through shortness of breath, swelling, strange fatigue, nighttime attacks of breathlessness, and slow changes in your body that are easy to brush aside. The 12 warning signs we have just walked through are not meant to frighten you, but to give you a clear map of what to watch for, so you can act early, not late. Listening to these signals and talking with your doctor in time can mean the difference between living in constant fear and living with confidence, control, and a treatment plan that truly works for you. If you have recognized even one of these signs in yourself or someone you love, do not ignore it. Write it down, pay attention over the next few days, and bring it to your healthcare provider so you can get proper testing and guidance. Heart failure is serious, but with early detection, modern treatments, and small daily habits, many people still enjoy years of meaningful active life. If this video helped you understand your body better, please click like, subscribe to our channel, and turn on the notification bell so you do not miss our next videos on senior heart health and healthy aging. And if you know a friend or family member who might be at risk, share this video with them today. Your one simple action could be the wake-up call that protects someone's heart and future.